Hi everyone. What is lymphedema really? March is Lymphedema Awareness Month, and I want to start at the foundation because most people misunderstand this condition completely. Lymphedema is not just swelling, it's a chronic progressive disease caused by damage and malfunction of the lymphatic system. The lymphatic system is responsible for moving protein-rich fluid, cellular waste, and immune cells out of tissues and back into circulation. When that system becomes impaired, fluid doesn't simply accumulate, protein accumulates in the interstitial space. That protein draws more fluid into the area and triggers inflammation. Over time, that inflammation leads to fibrosis, and fibrosis just means the tissue becomes firm, thickened, and less elastic. That's why left untreated, lymphedema doesn't stay soft and pitting forever. It changes the actual structure of the limb. This is what makes lymphedema fundamentally different from simple edema. If someone sprains an ankle, the swelling is inflammatory and temporary. If someone has congestive heart failure, however, fluid retention is systematic. Lymphedema is localized and driven by lymphatic dysfunction. There's no cure for lymphedema, but there is effective management, and early intervention can prevent progression, reduce complications, and preserve your quality of life. When ignored, however, lymphedema progresses, skin changes occur, you run the risk of infection, and of course, it decreases mobility. If swelling persists in one limb, especially in someone with a history of surgery, radiation, trauma, or venous disease, it definitely deserves evaluation. Awareness is the first step, and early recognition changes your long-term outcomes. So please be aware, be educated, and remember, lymphedema management is a journey, not an event.